Assalamualaikum friends, I'm here Sayyidah OMAMA SHAH, and today I will be discussing the mechanism of action of some of the inotropic agents. The agents that we will be discussing are the digoxin, amrinone, milrinone, dopamine and dobutamine. So if you guys are with me, I will start today's lecture. So first, before beginning the mechanism of action of these drugs, what an inotropic agent is. So it's an agent which increases the intracellular calcium concentration. So if you're going to increase the calcium concentration inside the cell, it will increases the muscle contractility because the calcium will bind to the troponin C, and thus the muscle contraction will enhance. Right now, how they are going to increase the calcium concentration inside the cell, we will start from that. If you can see over here, it is dopamine and dobutamine. These are the drugs and they are beta receptor agonist, means when they bind to the beta receptor they will stimulate its activity. So when dopamine and dobutamine is given to the patient, it binds to the beta adrenergic receptor. It then activates the G protein. So once the G protein is stimulated, it then activates the adenylyl cyclase. Adenylyl cyclase, what it do, it converts the ADP into CAMP. Right, so the result is or you may say the end result is the increased CAMP. Now what the CAMP will do, it will activate the protein kinase E, and what the protein kinase will do, it will enter the calcium from outside into inside the cell. Right, means it will stimulate the entry of calcium from outside to inside the cell. Right. Okay, inside, when calcium concentration increases, it also stimulates the sarcoplasmic reticulum, and it thus stimulate it to release the stored calcium which is present in the sarcoplasmic reticulum. This stored calcium is stimulated by the calcium entry from outside, and it is also stimulated by the CAMP. The CAMP also directly stimulates the L-type ranitidine receptor to please leave the calcium from the sarcoplasmic reticulum, and thus the calcium is released from the sarcoplasmic reticulum and its concentration increases inside the cell. So if more of the concentration of calcium is increased inside the cell, they will bind to the troponin C, and thus it will lead to muscle contraction. The CAMP is converted to AMP by phosphodiesterase. Right, this is an enzyme which converts the CAMP to AMP. So if CAMP level is decreased, the muscle will relax. Right, but what happens if you're going to give milrinone and amrinone? They inhibit this enzyme, so leading to the inactivation of conversion of CAMP to AMP. So if CAMP is not converted to AMP, CAMP level will increase. CAMP level will increase, and it will thus again lead to the stimulation of protein kinase A, and thus leading to the L-type ranitidine receptor to release calcium, and thus the calcium concentration will increase. Right, so milrinone and amrinone inhibit the phosphodiesterase 3 enzyme, and thus increasing the level of CAMP. And dopamine and dopamine, they bind to the beta adrenergic receptor, and thus by that way, by activating adenylyl cyclase, it lead to the increase in the CAMP level in the cell, inside the cell. Okay, so this was about the milrinone, amrinone, which are the phosphodiesterase 3 inhibitor, while the dopamine and dopamine are beta 1 adrenergic receptors. So both these all drugs lead to the increase in the CMP level, which thus increases the calcium concentration inside the cell. So if the calcium concentration inside the cell increases, it will lead to the binding with troponin C, and thus it will lead to the muscle contractility. Okay, now coming onwards, which is a special drug, it is digoxin. What the digoxin do? Normally, first I will discuss a normal mechanism. So here normally what happens, an ATP is utilized, and what happen, 3 sodium is exhaled and 1 potassium is inhaled, not inhaled, exhaled. 3 sodium leaves the cell, 2 potassium enters into the cell, right, with the expenditure of ATP, or you may say energy, right. Once again I will repeat, normally what happens, 3 sodium leave the cell, 2 potassium enters into the cell, right. So once the sodium concentration outside is increased, it is again entered into the cell, and through sodium potassium exchanger the calcium is moved out of the cell, right. The sodium enters and the potassium exits, right. So normally a cell removes its calcium from inside into the cell through sodium potassium exchanger, right. And here we have a voltage sensitive slow calcium channel. From this the calcium enters into the cell, and through the sodium calcium exchanger it is exhaled out of the cell. So the contraction and relaxation is normal, but we're going to increase the contractility, so we want the calcium to be remain here inside the cell. What this digoxin will do, it will inhibit the sodium potassium ATPase pump, right. So if sodium potassium ATPase pump is inhibited, there will be no means the sodium will not leave the cell, so the sodium concentration inside the cell will increase. So if there is no sodium outside the cell, the calcium cannot leave the cell. Here the calcium is coming, but it can't leave because there occurs in the reversal of the pump, because the sodium concentration now inside the cell is increased. It will try to be reversed, it will then be reversed. The sodium will exit and the calcium will enter into the cell, right. So both these cases will lead to the increase in the intracellular calcium level. So if the calcium level inside the cell is increased, it will also lead to the stored calcium in the sarcoplasmic reticulum to released from the ryanodine receptor. Increased calcium concentration inside the cell will lead to the binding of calcium to the troponin C, and thus leading to the contraction of the myocardium muscle cell. The inotropic agents are most commonly given to the congestive heart failure, and we studied that in the congestive heart failure video, that we have 2 types of heart failure. One is systolic heart failure, the other is diastolic heart failure. Systolic heart failure is heart failure with reduced ejection fraction, while diastolic heart failure is also called as heart failure with preserved ejection fraction. So this inotropic agents is basically given in heart patients which have systolic heart failure, because and there is reduced ejection fraction. So if a person take the digoxin or inotropic agents, any of the inotropic agent, it increases its contractility and thus the ejection fraction is then preserved, right. So it is basically given in the heart failure with systolic with reduced ejection fraction, or you may say systolic heart failure. So this was all about the inotropic agents and its mechanism of action. I hope you guys get some of information from my this video, and subscribe it, share it with your friends, because it gives me a great support from your side. And thanks for watching. Allah Hafiz for now.